Hello, and thank you for joining us today. My name is Natalia, and I work at the Community Food Bank, and I serve with Pima County Interfaith.
And I'm Nancy Smith. I am on the executive team for Pima County Interfaith here in Tucson, and I attend St. Pius X Catholic Community.
Now, you may be wondering, who is Pima County Interfaith? Well, we are everyday citizens from churches, synagogues, nonprofits, small businesses, and the like, who intentionally work across lines of religious beliefs, political philosophies, ethnicities, and economic levels. We develop both institutional and community leaders to address some of the most critical issues impacting our community. Today, we're going to talk about two things: the coronavirus and staying safe. Let's begin. Viruses are a sort of life form that is very abundant on Earth. They are similar to parasites in that they live inside of a host, like one of your cells. They are very efficient in getting into cells, taking over and multiplying. This virus mutates rapidly, which makes it very hard to treat. The coronavirus, like flu and hepatitis C viruses, have a sort of envelope surrounding them. This envelope is greasy, and soap and warm water do wonders to disrupt the greasy envelope and killing the virus. Now, the spiky things protruding from the coronavirus allow it to live longer on surfaces than other viruses do. They are also what allow it to attach to cells in the lower respiratory tract, the bronchia, and the lungs. This ability is what makes this virus so very dangerous. The disease caused by the new coronavirus is called COVID-19. Since COVID-19 is caused by a new coronavirus, humans have no immunity to it, like we do with the cold or flu. This means that our bodies can't fight it very well because we haven't developed a resistance to it. So far, there is no treatment that cures the virus. All doctors can do is try and control symptoms. In most people, coronavirus causes mild or moderate symptoms, or even none at all. But when coronavirus takes hold in the lungs, patients develop acute respiratory distress syndrome. You'll notice some green coloring on the photo on the slide, which shows coronavirus in the lungs. The elderly and people with underlying health conditions, like diabetes and chronic obstructive pulmonary disease, are particularly at risk. Now, the virus forms a sort of film in the alveoli, the air sacs of the lungs, which is where oxygen passes through a very thin tissue in the lungs into the bloodstream. In serious cases, coronavirus creates a film that gets thicker and thicker, and thus blocks the passage of oxygen into the bloodstream. It acts like a thick layer of paint in the lungs, and this is what kills people as they can no longer get air into their organs. Now, Nancy, can you please share with us how this is spread?
I sure can. First, I'd like to talk for just a minute about the coronavirus and the flu, because I see very often people comparing the two. And in some ways, it's a pretty valid comparison, but in others, it really isn't. So like flu, the coronavirus is primarily spread from person to person. It is, however, twice as contagious as the flu. While someone with the flu will infect about 1 or 2 other people, someone with the coronavirus is likely to infect 2 to 3 people. And since it's a very new virus and very contagious, many people in an area where the virus hits fall ill all at once, which can stress out our hospitals. According to the World Health Organization and the Center for Disease Control, it can take anywhere from 1 to 14 days for a person infected with the coronavirus to show symptoms. And symptoms tend to come on kind of slowly before they progress to a more serious illness. On the other hand, tends to hit people all at once, and it comes on just 1 to 4 days after exposure. While the flu causes hospitalization in about 2% of cases, the coronavirus causes about 19% of patients to be hospitalized, and of these, 1 to 3.4% will die. To translate that, that means that the number of people who die from the flu is about 1 in 1,000, whereas for the COVID-19, it's 10 to 30 per thousand. There really aren't enough tests yet in the United States for us to have really solid numbers on the case fatality rate, but we do know that it's quite high. Now, how is it spread? As I said, it's primarily person to person, and that person who gives it to you might not have any symptoms at all. It can also be acquired from an infected surface and transmitted by asymptomatic people. So when an infected coughs or sneezes or even talks, the coronavirus germs spread into the air around them. The germs land on other people, or you can inhale them. They may land on surfaces where they survive for varying amounts of time. If an infected person coughs or sneezes into their hands are another means of transmission. When you get the virus on your hands and then you touch your face, your eyes, your nose, or your mouth, the virus can gain access to your body and attach to your throat, your bronchial tubes, or your lungs. If you have the virus on your hands and you touch somebody else, you pass the virus on to them. And it's important to know that you can get that virus from some people who haven't yet developed symptoms, so they've been infected and they haven't developed symptoms, or someone who's infected but never developed symptoms. So many people get this and their symptoms are either very mild or non-existent. Experts also think that the longer you're exposed to an infected person, the higher your chance of contracting the virus and the more serious your disease may be. That's why it's such a threat to healthcare workers. Coronavirus survives on plastic and stainless steel for up to 3 days. Typically, you won't get it from food, but do be careful with the packaging of food, food that you buy or have delivered. Most of our food, we're going to wash it or we're going to cook it, and that will kill the virus. Now, to show how easily and stealthily, really, this virus spreads, I'd like to share a quick story about the son of a friend of mine. Joe teaches at a university in California, and in February, before people were really talking about the coronavirus, he came down with something just awful. And he struggled with it for a day or two, and then he stayed home for about 4 days. He had that cough, he was very fatigued, he felt pressure in his chest. And after a couple of days, he started feeling better, so he and his wife went out for brunch and were hanging around other people. And then Joe started hearing about the coronavirus. So being the economist that he is, he went back and checked the statistics for which students were infected at his university. And sure enough, there were many who had been infected in the classes that he taught, people he had worked with. And he figured he definitely had the coronavirus. Big deciding clue for him, he lost his sense of taste all during it. So people with no symptoms or before they're aware that they're infected can definitely infect us. So Natalia, can you tell us a little bit about the symptoms of COVID-19?
Yes. So some of the symptoms of coronavirus include a persistent fever, a dry cough, and shortness of breath. Now, these symptoms may appear 2 to 14 days after exposure. And Nancy, just as you had shared, another symptom can be that loss of taste or smell. So please be mindful of these symptoms if you have any of them. Now, I guess the other thing we want to talk about is how can you stay healthy during coronavirus? Now, we're looking at all of these images, and you may ask yourself, is any one of these more important than the other? And the fact is, they're all important. Number one, wash your hands with soap and water for 20 seconds. This disrupts the greasy envelope that I had mentioned earlier before that is around the virus and kills it. Hand sanitizer can be used if soap and water are not available. Number 2, cover your mouth and nose when you cough or sneeze. If you have a tissue, sneeze into the tissue, cough into the tissue. If that's not available, please cough into the crook of your elbow. Disinfect surfaces like in the kitchen and bathrooms frequently. Clorox or Lysol wipes, disinfecting cleaners, or a bleach solution all kill the virus. And don't forget doorknobs, light switches, and other commonly touched surfaces. Stay at home, except when necessary to get food or medicine, or go to work. Work from home if at all possible. If you have to go out, please be extra cautious. And this extra caution would include wearing a mask when you're out in public and around others. It's not just for your protection, it's for the protection of everyone else. People can spread COVID-19 before they show symptoms, or even if they show no symptoms at all. Please do not use N95 or surgical masks. These are for our healthcare workers. Make a cloth mask, or at least wear a scarf. If you're going to use cloth or a cloth face covering, it should fit snugly but comfortably against the side of the face, be secured with some ear loops, and include multiple layers of fabric. Additionally, it should allow for breathing without any type of restriction. And if you're going to use a cloth mask, it should be able to be laundered and machine dried without damage or change to shape. Now, Nancy, one of the things that has been talked about a lot is social distancing. What is this social distancing?
Well, according to public health officials, Natalia, social distancing is deliberately increasing the physical space between people to avoid spreading illness. It's been used many times with pandemics or epidemics in the past. So a couple of things to keep in mind about it. You should really be avoiding large groups. That's kind of easy now because all of our large group things have been canceled. But if you think about it, it makes a lot of sense. If you go out and meet just with one friend for coffee, you're sitting at a table fairly close together in Beyond Bread or somewhere, you are actually sharing all of the contacts you've had over the last 2 weeks with that person. And vice versa. They're sharing all of their contacts with you. You don't know who they've been with and don't know who you've been with. So it's really important to try to break the chain of infection. The real reason, or one of the reasons that our social distancing is to protect our healthcare workers from an onslaught of sick people. So maintaining our distance from others helps us to flatten the curve, as we keep talking about in the news. And that means fewer people are getting sick at once. And if that happens, then our emergency rooms and our ICUs can handle the number of people who are coming in. Now, one thing that might be hard to imagine is, what is 6 feet apart? We're used to thinking vertically or horizontally, tend to think of 6 feet in height, right? Well, if you imagine 2 large dogs standing nose to tail, that's about 6 feet apart. Another way to think about it is if you extend your hand straight out with your fingers extended, and the person you're talking to does the same, and you leave maybe 6 to 8 inches in between the tips of your fingers, that's about 6 feet. So that's the distance you should be maintaining. And you should try and maintain that anytime you go out. So in a grocery store. Other ways to maintain social distancing are to use the drive-through. Get pickup or delivery options for takeout food, groceries, any clothing you might need, prescriptions, and those kinds of things. And very important, we really have to avoid visiting our nursing homes, retirement, or long-term care facilities. They're on lockdown now, as you probably know, because their elderly residents are particularly vulnerable to the virus. Don't try to buck the system to see your loved one by going into their senior apartment via their patio door or having them hold an exterior door open for you. Stay away. These seniors are at such high risk. Stay connected virtually instead with your loved ones through video calls, phone calls, text, or social media. And as Natalia said, if you must go out, wear a mask. When you return home, wash your hands, wipe down your car, your doorknobs, your light switches, and anything else you touch. Be careful. So Natalia, what can you tell us about if a family member in my home gets sick, or if I get home and I'm sharing my home with someone else?
Mhm. If you or a family member living in your home is sick, but you don't need hospitalization, okay? Emphasis on you don't need hospitalization. Do the following. First and foremost, call your doctor or make a telemedicine appointment. The doctor will evaluate the sick person's symptoms and determine if testing is needed. If the sick person needs testing, the doctor will write an order and tell you where to go for the nearest test. Keep as much distance as you can. If possible, the sick person should stay in a separate bedroom and use a separate bathroom. Help the sick person with basic needs like food and liquids. The sick person and caregiver should both wear masks when the caregiver enters the sick room or the sick person leaves the sick room, for example, to use the bathroom. Do not share dishes or other household items. Regularly clean surfaces like counters, doorknobs, toilets, and tables. And I'll add another one into there, remote controls, for example. Lots of virus and germs on that. Wash your hands frequently. Everyone in the household must stay home. And the person must be quarantined for 14 days, as should the household. If someone else in the household falls ill, the quarantine is extended another 14 days from the onset of symptoms. Okay, so we just discussed, you're sick, but you don't need hospitalization. Some tips here for everyone. But Nancy, what if I get really, really sick? What does that look like? What do I do?
Well, if you get really, really sick, you should seek medical attention immediately. You can call 911, call the ER. Please call before you go if you can, and warn the medical personnel that you believe that you have COVID-19 or you know that you have it, so that they can be prepared when they come to get you. The symptoms: trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. There are other symptoms as well. So for example, if someone gets up and then they pass out, that would be an emergency symptom. And it really is an indication that that person just isn't getting enough air. So as soon as these things start, you should get help.
So we're going to be changing topics a little bit here, and we're going to be talking about the stay-at-home order. Now, what is the stay-at-home order? This is something that was issued by Governor Doug Ducey, and it's been in effect since March 31st and is scheduled to stay into effect until April 30th. Now, this may be extended depending on our situation.
And you might ask the question, well, why should I stay at home? I'm not sick. My family members aren't sick. Well, really and truly, our faith demands that we take care of ourselves and we take care of each other. Staying at home protects everyone, and morally, it's the right thing to do. If I venture out, and when I do, it's not very often, but go to the grocery store or something, it seems like a lot of people maybe are violating the stay-at-home order, at least if I'm judging from the traffic on the road. We all really be acting as if we have the disease. If you are sick with anything, absolutely stay home. I can't emphasize enough how important this is. Our healthcare workers need our cooperation with the stay-at-home order in order to maintain their health, our health, and our healthcare system. They have asked us to stay home except when necessary and only to leave with good reason. We need to respect their request and help take care of our community by doing so. So when can I leave my home? According to Governor Ducey, I can leave to get groceries and prescriptions. And we should really plan our grocery trips so we don't need to go more than once every 10 days or 2 weeks. I know sometimes planning can be an issue, but we should really do that. We can leave if our work is considered essential, and there's a long list of things that are, and if our work cannot be done at home and is essential. We should, of course, if we need to seek emergency care, and not just for COVID-19. If you think you're having a heart attack or a stroke, or you've severely cut yourself or broken your hip, by all means, go seek emergency health care. If we need to care for a family member, a friend, or a pet in another home, as we sometimes need to do, we can leave our home to get some exercise. We should maintain social distance, but being outside is actually pretty safe as long as we maintain that distance. If we work in a business that's not open to the public, we are allowed to go out. And to engage in free speech or religious activities. And having said that, we've all seen the protests on television. Notice they are not maintaining social distance. They are not wearing masks in many cases. Probably not the best way to engage in free speech. And so we would encourage you to use social media for your speech and attend your religious activities virtually. There was a change we want to make sure everybody knows about. At the beginning of the stay-at-home order, you could do things like haircuts and pedicures and that, but Governor Ducey did change that. So personal care services, such as the ones you see on the slide, and others like massages, tattoos, personal training, hair coloring, all those things we love to do, are no longer allowed until the governor notifies us that that changed. So we'll have to do our own nails and get shaggy hair together.
Mm-hmm. So, folks, this is really, really serious. Anyone who knowingly violates the executive order is guilty of a Class 1 misdemeanor, according to Arizona law. Now, our sheriff and Tucson police chief have stated that they will first try to educate the public on the stay-at-home order and only charge offenders if they continue to violate the order. But this is very serious.
And we want to thank you for your time today. And if you have stories about COVID-19 in your family, how it's affected you, that you would like to share, go to PimaCountyInterfaith.org and follow the links, and you can share your stories there. We'd love to hear from you. Thank you very much.
Thank you.